For some people, when they first hear the term post-traumatic stress disorder, the initial thought that is likely to cross their minds is that it is something that war veterans struggle with. But is this the full extent of the truth? You can find out watching this video. Well, if you do think of war veterans when you hear this term, you are not wrong. However, PTSD goes far beyond that and affects more than just one group of people. In today's video, you will learn about the 5 types of PTSD and how they are experienced by those who deal with them on an everyday basis. Hang around to the end of the video for some unusual facts about PTSD. Number 1. Normal stress response. First up, normal stress response. This occurs when healthy adults go through a single distinct traumatic event that disrupts their lives. You might be wondering what it is like for the sufferers. Often, they can't figure out their feelings and instead they experience emotional numbness. They also tend to feel cut off from reality. So when you're trying to have a conversation with a person suffering from this type of PTSD, you are unlikely to get the response or reaction you expect. Take for instance when people suffer a nasty breakup or divorce. The loss of that significant relationship can lead to this type of PTSD. One moment they may be crying, and the next minute they might be smiling and laughing at funny pictures they shared with their ex on WhatsApp. Psychologists have stated that the normal stress response is a mild type of PTSD. So what does that mean for recovery? The implication is that those with normal stress response can achieve complete recovery within a few weeks. Great news, right? An incredible beneficial recovery tool is group therapy sessions. You might be thinking, how will being with others help when they said they feel cut off from reality? Here is how it works. When one meets others like them who have also experienced traumatic events, together they can share experiences. As a group, they can explore ways to come up with solutions, find closure to heal, and move on with their lives. After struggling through a life-changing event, you might be displaying some anxiety disorder symptoms. Could it be a normal stress response type of PTSD? If you are still unsure if this could apply to you, don't worry, as we have 4 more types to look at next. One of them might just be the light bulb moment. Number 2. Comorbid PTSD. When people suffer this type of PTSD, they are also commonly diagnosed with other mental health disorders like depression, panic attacks, anxiety, or even substance abuse. This type of PTSD is the one most experienced by war veterans. However, it's important to note that they are not the only set of people affected by this type of PTSD. These comorbid PTSD patients often re-experience their traumatic event of the past through flashbacks which may come as disturbing thoughts, memories, or even nightmares. To escape this, they may turn to drugs, alcohol, or other self-destructive habits. When their triggers are activated, for instance, they might hear a loud noise. Instead of simply being startled, their minds often process it instead as a threat. This can cause the development of a behavioral pattern referred to as hypervigilance. I'm sure we can understand where that comes from. It must be almost impossible for many war veterans to forget those long hours of loud and terrifying explosions and gunshots. It makes sense. When treating comorbid PTSD, it is most important to be aware of any other mental health problems which must be treated alongside it. This will lead to a greater chance of recovery down the road. In some cases, these individuals may feel depressed and hopeless, often feeling like because of their past, they deserve this suffering. If you have a loved one with this type of PTSD, then you should try to show support and reassure them as much as you can. Be patient, understanding, and never trivialize or underrate their experiences or what they're currently going through. Number 3. Acute stress disorder. This type of PTSD is not as common as the 2 PTSDs we discussed earlier. Acute stress disorder often occurs when a person experiences a sudden loss of a loved one or a disaster that causes them to lose their homes or families. It could be a car accident, earthquake, tsunami, or an act of terrorism. These traumatic events can cause victims to suffer severe insomnia and extreme forgetfulness, along with feelings of being afraid and on edge. They tend to forget simple things extraordinarily easily, even the most basic things like their personal hygiene. I doubt you've ever heard someone saying they forgot to sleep. Well, it's a common occurrence with this type of PTSD. Additionally, these sufferers may constantly feel suspicious and paranoid. They're often not sure of whom to trust or who they can get close to. Can acute stress disorder be treated? Thankfully, yes. If you're experiencing this kind of PTSD, it is highly recommended that you remove yourself immediately from any traumatic situations that may be triggering your condition. You should also consult a health professional for prescribed medications. Some people may think therapy is overrated or a waste of time. But in fact, seeking the help of psychologists and specialized therapists can make a world of difference in your healing process. Number 4. Uncomplicated PTSD. First things first, there is nothing uncomplicated about this type of PTSD. Kind of ironic, isn't it? Just like comorbid PTSD, uncomplicated PTSD causes individuals to re-experience their traumatic events constantly through flashbacks. As such, they tend to have this strong desire to avoid anything that can remind them of their trauma. For instance, someone who has been sexually assaulted may experience this type of PTSD. Due to their past experiences, they often avoid any form of commitment or relationships with other people. Intimate acts may also be hard for them. So how long does it take to recover from this? As it turns out, uncomplicated PTSD is one of the easiest forms of PTSD to treat, especially when it's detected early. Perhaps that explains why it's referred to as uncomplicated. In any case, those who are diagnosed with this type of PTSD often respond well to treatment. This seems to be the case only when you engage in effective therapy sessions in addition to taking the proper medication prescribed by medical professionals. Number 5. Complex PTSD. This is also known as a disorder of extreme stress. Notice the emphasis on the word extreme. This type of PTSD is, as the name suggests, particularly complicated, so listen up. Complex PTSD is common among individuals who have experienced traumatic events for an extended period of time. Let's break this down a little more. In many cases, the previous 4 types of PTSD that we have just discussed may be a result of a one-time traumatic occurrence. However, for the complex PTSD diagnosis, the traumatic events have been occurring for a much longer period. Examples of this include domestic violence, physical, verbal, or sexual child abuse. Why are these traumatic events so prolonged in the first place? In reality, it is usually much more difficult for the victims to get themselves out of their damaging situations than one realizes. Because of the type of event that triggers this PTSD, it may not be surprising that women and children are usually the ones most affected. Like comorbid PTSD, the complex PTSD sufferers are also often diagnosed with a borderline antisocial personality disorder, depression, panic attacks, or negative self-perception. Notably, complex PTSD often takes much longer to heal. For instance, a child who has suffered at the hands of traffickers for years will surely require a system of well-organized treatment options and the help of very competent psychological specialists. If left untreated, people with this type of PTSD will usually deteriorate. They tend to develop more self-destructive conditions like eating orders and drug abuse. Now, don't be discouraged. Even with complex PTSD, you can still make a full recovery. However, you do need to be patient with yourself. Take it one step at a time and you will realize that you are far stronger than you think. Most importantly, make sure you receive proper medical advice and treatment to help manage your symptoms, and let those close to you support you through your recuperation. Now, as promised, some lesser-known facts you may not know about PTSD that are worth mentioning. Women are twice as likely to develop PTSD than men. PTSD symptoms may not appear until years after one's experience of a traumatic event. Exercise is extremely helpful for people with PTSD, with some studies suggesting it's just as effective as therapy. PTSD is now a fast-growing epidemic across the world, partially in thanks to the outbreak of the pandemic and subsequent global consequences. Children can also develop PTSD, which can be observed in the way they play or draw. In teenagers, it's likely to manifest in the way it does in adults and display itself in angry or aggressive behavior. Alright, so now we have looked at the 5 types of PTSD and how they manifest themselves. We hope this has been helpful in clearing up any questions you may have had about this application. Do you know someone who is struggling with PTSD, or perhaps you are yourself? We want to let you know that you are not alone, no matter how much it feels like it. What you are experiencing is real and it's not your fault. If you feel like sharing, we welcome you to share your personal experiences with us or let us know your opinions of this video in the comment section below. Then make sure to give it a thumbs up and subscribe to our channel for more interesting content.